Hello, my name is Donna Edwards, and welcome to Addiction Counselors CEU. We are going to be discussing abnormal psychology, past and present. What is abnormal psychology? The field devoted to the scientific study of abnormal behavior to describe, predict, explain, and change abnormal patterns of functioning. Workers may be clinical scientists, clinical practitioners. What is psychology abnormality? Many definitions have been proposed, yet none is universally accepted. Most definitions, however, share some common features. The 4 Ds. Deviance, different, extreme, unusual. Distressed, unpleasant, and upsetting. Dysfunction, interfering with life. And danger, pose risk of harm. Let's talk about deviance. From what? From behaviors, thoughts, and emotions considered normal in a specific place and time and by specific people. From social norms, stated and unstated rules for proper conduct in a given society or culture, which is a group of common history, values, institutions, habits, skills, technology, and arts. Judgment of deviance also depends on specific circumstances, such as social. Then there's danger. Abnormal behavior may become dangerous to oneself or others. Behavior may be careless, hostile, or confused. Although cited as a feature of psychological abnormality, being dangerous is the exception rather than the rule. Then there's dysfunction. The inability to carry on everyday activities. Elusive nature of abnormality. Ultimately, each society selects the general criteria for defining abnormality and then uses those criteria to judge particular cases. Thomas Szasz argues that because of the influence of culture, the whole concept of mental illness is invalid. Deviations called abnormal are only problems in living. Societies use the concept of mental illness to control those who threaten social order. What is treatment? According to Jerome Frank, all forms of therapy have 3 essential features. A sufferer who hopes the healer can provide relief. A trained, socially acceptable healer whose expertise is accepted by the sufferer and his or her social group. A series of contacts between the healer and the sufferer through which the healer tries to produce certain changes in the sufferer's emotional state, attitudes, and behavior. Psychological practitioners. Counseling psychologists helped people deal with the problem associated with everyday life. School psychologists work with parents, teachers, and students to enhance students' performance. Clinical psychologists diagnose, treat, and study mental or emotional problems. Psychotherapist is anyone who does any type of psychotherapy. Psychoanalysis are individuals who receive training in psychoanalysis, and psychiatrists are medical doctors who diagnose and treat mental disorders. Clinical psychologists are not the same as these individuals. The DSM-5 2013 requires clinicians to provide categorical information. Name of category disorder indicated by symptoms. An example is major depressive disorder. With the dimensional information, that is the severity of client's symptoms. Rating scales vary according to the disorder. Here is an example of a diagnosis of major depressive disorder. The severity rating is 5, markedly ill. Additional information are medical problems, which is diabetes, and the psychosocial problem is termination of relationship. Can diagnosis and labeling cause harm? Misdiagnosis always is a concern. Major issues is reliance on clinical judgment. Also present is the issue of labeling and stigma. Diagnosis may be a self-fulfilling prophecy. Because of these problems, some clinicians would like to cease the practice of diagnosis. Others believe we simply need to improve the diagnostic technique. Let's take a look at this graph of an explosion of mental disorder. Supporters of new categories answer that it is important to distinguish disorders precisely. Critics point to economics. Diagnoses are needed for insurance reasons for therapists to be compensated. Advantages of the DSM. When the manual is used correctly and the diagnoses are made with valid objective tests, the DSM improves the reliability of the agreements between clinicians. Culture and DSM. Culture-bound syndromes, sets of symptoms specific to the culture in which they occur. An example is Native American tribes. Ghost sickers are preoccupation with death and the dead, with bad dreams, fainting, appetite loss, fear, hallucinations, etc. How was abnormality viewed and treated in the past? In any given year in the U.S., 30% of adults and 19% of children display serious psychological disturbances and are in need of treatment. In addition, most people have difficulty coping at various times in their lives. How was abnormality viewed and treated in the past? It is this fault of modern society? Well, let's see. What issues and problems do we have today that we didn't have in the past? Historical records demonstrate that every society has witnessed psychological abnormality and had its own form of treatment. Ancient Stone Age views and treatment. Most of our knowledge is prehistoric societies, has been acquired indirectly based on interferences from archaeological findings and is limited. Most historians believe that prehistoric societies regard abnormal behavior as the work of evil spirits. Ancient views and treatment. The cure of abnormality was to force the demons from the body through trepanation. It's an ancient operation in which a stone instrument was used to cut away circular section of the skull, perhaps to treat abnormal behavior. Then there was exorcism, which was a coax evil spirits to leave or make person's body uncomfortable place in which to live. Greek and Roman, 500 BC through 500 AD. Hippocrates, father of modern medicine, believed that mental illness had physical causes, imbalance of the humor, bodily fluids. Yellow bile, mania. Black bile, melancholia, had become overly preoccupied with the tragedy and cruelty in the world, thus becoming depressed. Treated mental illness by recommending changes in lifestyle such as exercise, diet, and rest. European in the Middle Ages. With the rise of clergy came the downplay of science, rejection and scientific forms of investigation and control are all education. Abnormality was given seen as a conflict between good and evil. People were looking for explanation for wars, famine, and disease. Earlier, largely discarded treatments such as exorcism re-emerged. In the Renaissance era, science again took center stage as the church became less influential. The first community mental health program was in Gilly, Belgium. The rise of the asylums. A type of institution that first became popular in the 16th century to provide care for persons with mental disorders. Most became virtual prisons. In the Renaissance, asylums started out with good intentions, but were overwhelmed by number of patients, funding, and staff shortages. It became lockdowns and in some cases tourist attractions for the wealthy. Moral movements of the 19th century. Philippine File, a French physician, outraged at the condition in asylums and began a movement to reform them, unchained patients and changed living accommodations from prison-like cells to bright, well-ventilated rooms, treated the mentally ill with respect, and demanded that his staff do the same. In the U.S., Benjamin Rush was changing the way the mentally ill were treated. He had his staff offer advice and support to their patients and even had the staff give patients small gifts. This was in the moral movement of the 19th century. One of the biggest reformers and proponents of the rights of the mental ill was the Boston school teacher turned lobbyist Dorothea Dix. Lobbied state legislators, formed hospitals for the mentally ill, personally helped establish 32 state hospitals, pushed for new law and for protection of the mentally ill. Like asylums, state hospitals started out with good intentions but became overwhelmed by funding issues and staff shortages. Many became little more than warehouses for the mentally ill. How are people with severe disturbances treated? In the 1950s, psychotropic medications discovered antipsychotics, antidepressants, and antioxylics. These discoveries led to the deinstitutionalization, and a rise in outpatient care. How are people with severe disturbances treated? Since the 1950s, there have been an increase in outpatient care. While this type of care was once exclusively private psychotherapy, it now includes various settings such as family service centers and community mental health centers. Growing emphasis on preventing disorders and promoting mental health. The community mental health approach has given rise to the prevention movement. Many of today's programs are trying to correct the social conditions associated with psychological problems, identifying and help those at risk for developing disorders. Prevention programs have also been energized by the rise of positive psychology, the study and promotion of positive feelings, traits, and abilities. With the multicultural psychology, in response to the growing diversity in the U.S., new area of study has emerged. Multicultural psychologists seek and understand how culture, race, ethnicity, and gender affect behavior and how people of different cultures, races, and genders may differ psychologically. 2 areas of focus for clinicians: the greater sensitivity